Thank you for joining us here at the CHART Statewide Operations Center. Over the past several weeks, we have been saying that while we're hoping for the best, we are also actively preparing for the worst. A few hours ago, the World Health Organization declared the coronavirus outbreak to be a global pandemic, saying we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction, and citing that the number of cases outside of China has increased 13-fold, and the number of affected countries has tripled in just the past 2 weeks. Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Diseases, told leaders on Capitol Hill today that the coronavirus is roughly 10 times more lethal than the seasonal flu. Tomorrow, I will be addressing the nation as I give the State of the States address on behalf of America's governors as chairman of the National Governors Association at the National Press Club in Washington. But today I'm here to update you on the latest in Maryland. But first, let me just give you some of the most up-to-date big picture facts as we know them. As of this hour, and the numbers may even be changing behind me, but more than 121,000 people in over 100 countries have been infected by COVID-19. Over 4,300 people have died. Here in America, there are over 1,000 cases and 31 deaths across 42 states and Washington, D.C. 24 governors have declared a state of emergency. This situation is escalating rapidly. Information is changing not only on a daily basis, but on an hourly, almost minute-by-minute basis. Here in Maryland, the state currently has 9 confirmed cases of COVID-19. Earlier this afternoon, I announced that a Montana resident who was visiting Anne Arundel County tested positive after being alerted that she had been in close contact with a confirmed case. The patient, a woman in her 70s, presented for testing at a hospital here in Anne Arundel County, which did take all of the necessary precautions to protect patients and staff. While this will be classified as a Montana case, the Maryland state and local health officials are taking the lead in the investigation and tracing the patient's interactions with the public. We are working in close coordination with Montana officials, and I have been in touch with Governor Steve Bullock. As I announced earlier this week, the U.S. Department of Health and Human Services has notified us that 12 Marylanders are aboard the Grand Princess, which is docked on the coast of California. All 12 Marylanders and the other U.S. citizens on that ship are in the process of being transported to military bases in Texas and Georgia for examination and to be quarantined. Last night, the Department of Health and Human Services submitted a request to us to send those passengers who are not showing any symptoms back to their home states. We want these Marylanders to be able to come home. However, we also want to take every precaution to limit the spread of COVID-19 in our state. So we have informed the Department of Health and Human Services that they must test all 12 of these passengers for COVID-19 on the military bases before we take any steps to return them here to Maryland. All those who are cleared and test negative will be safely transported back here to Maryland. Anyone who tests positive will remain in quarantine on the respective military base. We will continue to provide updates as that situation develops. Also last night, we learned that a volunteer first responder in Montgomery County, who is a resident of Prince William County, Virginia, has also tested positive for COVID-19. This case is tied to the rector of Christ Church in Washington, D.C. So the state of Maryland is coordinating on this investigation with the Virginia and D.C. health departments. And I can report to you that our state's chief epidemiologist has cleared both the fire station and the fire crew where the patient volunteers and has no major concerns regarding potential risk to the community. I also want to provide an update today regarding the village at Rockville, the retirement community where one of our first positive cases attended a gathering in late February. We are deploying a team of health department officials to test those residents, staff, and family members who attended the event and who want to be tested. We are fully committed to being transparent, providing all the facts, and continuing to keep Marylanders informed. Yesterday, I convened a nearly 2-hour emergency meeting of our entire cabinet and senior staff, where we discussed additional measures in our all-hands-on-deck operation to combat this evolving threat. Today, I am announcing that the state's Motor Vehicle Administration will immediately begin moving toward an all-appointments system for all transactions in order to eliminate walk-ins, reduce foot traffic, and keep crowds to a minimum. The Maryland Health Benefits Exchange is establishing a special enrollment period through Maryland Health Connection specifically for the coronavirus. Through the federal though the federal marketplace is not offering this kind of enrollment, we wanted to do so in order to provide peace of mind to Maryland residents. The Department of Public Safety and Correctional Services is discontinuing visits for individuals currently in infirmaries, reducing programs and movement within facilities, providing more video visitation opportunities, and requiring staff who exhibit any flu-like symptoms to remain home. Yesterday, I convened the leaders of the state's long-term care community, which includes nursing homes, assisted living facilities, and retirement communities. Today, we issued the following directives effective immediately. Nursing homes will have restricted access to essential visits only. We will be prohibiting other non-essential visits, prohibiting all staff from any international travel, and we are recommending that these facilities actively screen all individuals entering all of these facilities and restrict entry to anyone showing any respiratory symptoms or anyone with any possible exposure to COVID-19. I am also announcing today that all state veterans facilities will be required to follow these same guidelines. The National VA has also done this nationwide. Our Charlotte Hall Veterans Home will also be instituting these guidelines. Once again, I want to remind everyone that the state of Maryland is operating under a state of emergency. Marylanders should be taking this pandemic very seriously. All Marylanders need to understand and prepare that there may be significant disruption to your everyday lives for a period of time. Local schools and daycares should be prepared with contingency plans for potential long-term closures. Local communities and cities should actively consider modifying, postponing, or canceling mass gatherings. Local businesses should prepare plans for office closures that require their employees to work from home for extended periods of time. These are the kinds of things that people need to start planning for immediately. I urge Marylanders to remain calm, but to stay informed on a continuing basis by paying attention to the media. And all of you, thank you for helping us get this message out. Also by visiting the federal website, coronavirus.gov, And Maryland residents can also get the latest updates at health.maryland.gov/coronavirus. And if you have any questions or concerns, you can call our hotline at 211 to connect with a helpline representative to get information or community resources on the coronavirus. We will continue tracking this. We will be receiving and providing Marylanders with almost constant, up-to-the-minute information. And I want to continue to assure all the people of our state that Maryland is taking every potential precaution when it comes to this coronavirus, because our highest priority is keeping our residents safe.